Higher education and education in general used to be holistic. We talk about the Renaissance, and you talk about scientists and researchers and philosophers in the 16th, 17th, 18th centuries. They were artists and scientists and philosophers in one person. And they would be just as happy to carve marble as they would be to run a chemical experiment. And so at some point, we decided to specialize in academia, and we created silos and walls that set up barriers between disciplines that seemed natural at the time. And we pushed in that direction for well over a century. And we ended up getting to a point where we had extreme expertise in very narrow topics, which is good. If you want to understand that as deep as possible, then you need that level of segregation. But if you want to understand how the world works, the world does not work in separated silos. And so there's always been different attempts to bring disciplines together, and they've taken different forms. And the One Health approach, I think, is a fantastic way of bringing together any discipline that considers the interactions between humans, plants and animals, and their environment within the context of health. That's the main glue that holds it all together. And so I think that's why One Health approach is extremely important, because it breaks down barriers that in some ways are artificial.